Sinus infections and strep throat are both common conditions that affect many individuals, but they stem from different causes and exhibit distinct sets of symptoms. A sinus infection, or sinusitis, typically causes pressure in the forehead, cheeks, and behind the eyes, with discolored nasal discharge and a persistent cough, whereas strep throat presents with a sudden sore throat, pain when swallowing, and often white patches on the tonsils. Treatment for a sinus infection may involve decongestants, nasal sprays, and sometimes antibiotics if a bacterial infection is confirmed, while strep throat is primarily treated with antibiotics to eradicate the Streptococcus bacteria. Risk factors for a sinus infection include allergies, nasal polyps, and previous colds, whereas strep throat is particularly prevalent among children and those in crowded environments, such as schools. Understanding both diseases enables better symptom recognition and more effective management of these troubling yet treatable conditions. Here's a look at the detailed aspects of sinus infections and strep throat to further our understanding. Affected tissue type: mucosa of sinus cavities versus pharyngeal tissue. When discerning between a sinus infection and strep throat, recognizing the affected tissues is essential. Sinus infections, or sinusitis, target the mucosal lining within the sinus cavities, leading to symptoms such as nasal congestion, pressure around the eyes or forehead, and a postnasal drip. This contrasts with strep throat, which affects the pharyngeal tissue, resulting in a sore, scratchy throat, pain while swallowing, and white patches on the tonsils. Strep throat is also frequently accompanied by fever and swollen lymph nodes in the neck, which are less common in sinus infections. Careful evaluation of these symptoms can guide professionals toward accurate diagnosis and treatment, whether it be antibiotics for a bacterial infection or other supportive measures for viral causes. Common symptoms: nasal congestion versus sore throat. In distinguishing between a sinus infection and strep throat via common symptoms, nasal congestion is particularly indicative of a sinus infection. When sinuses are inflamed, it impedes normal airflow and mucus drainage, resulting in a stuffy nose. Contrarily, strep throat primarily manifests with a sore throat due to bacterial infection, Streptococcus pyogenes. It is often accompanied by pain when swallowing and can include red and swollen tonsils, sometimes with white patches or streaks of pus. While both conditions can cause discomfort, the presence of nasal congestion usually points toward a sinus infection, and a pronounced sore throat with difficulty swallowing leans more towards strep throat. Common causative agents: viruses versus group A Streptococcus bacteria. When distinguishing between a sinus infection and strep throat, recognizing the different causative agents is key to proper treatment. Sinus infections, or sinusitis, are often triggered by viruses similar to those causing the common cold, leading to inflammation and congestion of the sinuses. Antibiotics usually aren't effective because viruses are the culprits. On the contrary, strep throat is a bacterial infection specifically caused by group A Streptococcus bacteria. It is identified by symptoms like a sore, red throat with white patches and fever, and it requires antibiotic treatment to avoid complications. Distinguishing them through clinical presentation and possibly laboratory tests is essential because the treatments vary significantly based on the causative agents. Pain location: facial pressure versus throat pain. When distinguishing between a sinus infection and strep throat, pain location plays a significant role in differential diagnosis. A sinus infection, or sinusitis, often leads to facial pressure and pain, particularly around the forehead, cheeks, and nasal area, due to inflammation and blockage of the sinuses. Patients may also experience postnasal drip, which can cause discomfort and a sore throat. Conversely, strep throat, a bacterial infection caused by group A Streptococcus, primarily features a sudden, severe sore throat without the cold-like symptoms that accompany a sinus infection. The pain is usually centered in the throat and can make swallowing quite painful. Notably, the presence of white patches or streaks on the tonsils is more indicative of strep throat. Understanding these nuances helps clinicians to accurately diagnose and treat these conditions. Typical onset: gradual, sinus congestion builds, versus rapid, sore throat onset swift. In differentiating between sinus infection and strep throat, one of the telltale signs is the onset speed of symptoms. With sinus infections, patients often experience a gradual buildup of symptoms, such as nasal congestion, postnasal drip, and facial pressure or pain that intensifies over several days. These infections typically originate from a common cold or allergies, leading to sinus blockages and subsequent bacterial growth. In contrast, strep throat is marked by a swift and sudden onset of symptoms. Patients can pinpoint when the sore throat began, frequently accompanied by severe pain, fever, and swollen lymph nodes, with no preceding nasal symptoms. This rapid emergence is due to the aggressive invasion of throat tissues by the group A Streptococcus bacteria. Understanding these onset patterns can be crucial for clinicians to provide timely and appropriate treatment.